Uncluttered and Unfiltered is brought to you in part by our latest obsession, pain cakes. Pain cakes are the revolutionary cold pack that stick to you so you can stick to your routine. Whether you're pounding the pavement as a runner like me or you're tackling the clutter as a professional organizer like Christine, Pain Cakes has got you covered. Pain Cakes comes in 3 sizes and can be used again and again. We both keep them in our freezers, and when we feel an ache or a pain, you just stick them on your body. You can do it 100 times. It's all the benefits of using a cold pack, but no downtime. Find Pain Cakes at pain-cakes.com or at thousands of retailers nationwide.
Welcome to Uncluttered and Unfiltered, the podcast urging you to let it go and don't look back, with nationally acclaimed professional organizer Christine Stone and self-proclaimed hot damn mess radio and TV personality Eden Kendall.
Welcome, everybody, to another episode of Uncluttered and Unfiltered, the podcast for women over 50 with Eden and Christine. And today's episode may, at eye level, pun intended, seem like something that doesn't affect you right now, doesn't interest you. I am here to tell you, and Christine is here to tell you, you need to be listening to this entire podcast episode because there are a lot of things that affect people's eyes as they age. More women than men. And we have some statistics that are very mind-blowing, and you're going to hear about those. And as women hit menopause, they experience a lot of symptoms that are unpleasant that could potentially be avoided.
Right.
And so even if you're not experiencing these things yet, you may one day. So stay with us for that. But just a little chit chat right off the top here. A couple of things we're excited about. First things first, there is a documentary that is coming out this week. And at the point of when this episode releases, it will be the next day, I think, June 13th.
Yeah.
Is the Brat.
Ugh, I can't wait.
It's about the Brat Pack.
Yeah, the documentary.
So if you are our age, then these names, Rob Lowe, Emilio Estevez, Ali Sheedy, Demi Moore, who else is part of that whole group?
Molly Ringwald, John Cryer. Yeah.
Their documentary is coming out. And so I'm very excited.
Well, we were talking before, and I didn't realize I graduated college in 84. You were starting college.
I graduated high school in
right.
84.
And
right.
so it's funny. We never really put that together. And my years were, the Breakfast Club, St. Elmo's Fire, About Last Night, all the Brat Pack movies. So I am more than excited. I
liked them. I did. I really did. But I think especially St. Elmo's Fire, which was more about an after graduation type life. I think you probably that resonated more with you. And also the, what was it? The Last Night?
About Last Night. Well, I was living in Chicago, and that's where they filmed About Last Night and all the bar scenes. And I had been to all those bars. So I was living there when that movie came out. So yeah, I'm a huge fan.
Well, we'll be talking about that, no doubt. And the other thing we want to chat with you very briefly about, because I'm on the fence about something, and I feel like I may as well just put it out there for accountability. This is the first time I've ever shown up for one of these things without getting my root cover-up spray for my skunk stripe, because I think I might go gray. I think I might grow it out gray. And of course, I promise if I do this, we will share it all with you.
Absolutely. And I have to say, I saw it beforehand, and I've never seen such soft gray hair. I have the opposite. Mine is very kinky and coarse. So I love that we both have, I would never, but I love that you're even contemplating it. And I'm on your side one way or another.
Well, right now, you can head over to our Uncluttered and Unfiltered Instagram, and there's a poll. It's one of the reels that's up there also has a poll, so you can vote on whether or not you think I should go through with it. I mean, listen, it's not that deep. What do you care if I do it?
Right.
But you might be thinking of doing it, in which case, let me at least do some investigating for you. Let me at least put it out there. I know a lot of you guys listening are like, what is the big deal? I've been doing this for years.
Right.
Or I never dyed it in the first place.
Or there's me who's like, oh my God, you're the bravest person I know on the planet. Okay, go ahead.
On the scale of 1 to brave, I am that is not brave. All right. So Tell me a little bit about your weekend. I went out of town. Yeah.
No, not Nashville. I went to Sarasota for the weekend.
This was the Sarasota weekend.
And, I have been suffering. This is why I'm going to say I'm so excited to have the doctor here today from dry eye for, I would say, since my early 50s, like in that area. But it has got really worse, especially in the past year, I would say. And I think menopause does have a big effect on that. So anyway, I have been doing the whole thing with steroids and, just disposable contacts, just dealing with it. And it's a real pain. I can say that. So I tried these new stick-on lashes that you don't need glue. They already have glue on them, and they're like little winged wispy things. So It's not a full lash.
And they go underneath, right?
They go underneath, but then of course they had to be very careful because they're supposed to just go on the eyelash part. And I didn't want to scratch like the line of my eye, which I always do with everything that touches my eye. I seem to scratch the inside of my eye. And I have to say, I was like, I can do this. It took me like 45 minutes, though, just to get one on because I don't do fake eyelashes. But I think this might be an option if I can't figure out how to get on top of the dry eye.
Well, let me tell you something. If we wanted to do an episode on this show about eyes, about keeping your eyes safe, about keeping your eyes healthy, about finding ways to do things like what you're talking about, I'm sure there are some wonderful male doctors out there that would come on and talk to us, but I can't think of anyone better than the guest that we have for you today. So our guest is Dr. Kimberly Riordan. She's an optometrist with Florida Eye Specialists, and she's head of the Dry Eye Center for Excellence. And she's going to confirm a few things for us. For one thing, she's going to confirm what we know, and that is menopause can be the cause of just about anything that ails you. I mean, if there's something going on in your life, ladies, and you have reached menopause, don't discount the fact that it could be something from menopause. Dr. Riordan, first of all, thank you so much for joining us.
Well, thank you so much for having me here. I'm so excited because I could talk about this all day long.
And so can Christine.
So could I. That is for sure. This is a struggle.
Let's talk about some of the statistics, first of all, the very serious ones about women and their eye health and blindness and that kind of seriousness.
So, I want to start with, before I lose track, menopause and our hormones. And that's huge. It affects our whole body. Our eyes are no exception. It's all connected. And when it comes to dry eyes, I'm going to get a little technical, but in the eyelids are what are called meibomian glands, and they produce the oil for the tear film. They are driven by sex hormones, right? So as we're going through our changes and we don't have as much testosterone, or we have too much estrogen, that actually has an effect on those oil glands, because not enough testosterone, they don't work as well. Too much estrogen, they don't work as well. So we need a balance in our hormones. So as we're going through these huge hormonal changes, has a direct effect on the tear film in our eyes. And that's why the eyes get dry.
We're both looking at each other. Wow.
Zoinks.
Gosh.
When this was a cartoon, it would say zoinks.
Right.
Because it's one thing to say, yes, it affects your eyes, but it's quite another to have a medical reason and some big words to go along with that. And, when we're talking about things like dry eye, yes, it's annoying, but also it can cause other things. I know for me, for example, I can't wear contact lenses anymore. And I've tried many, many ways. The Restasis, eye plugs in the tear ducts, a lot of different things, as has Christine.
I've tried everything.
So eye disease also is a huge concern. So let's put one thing on the table first and then move forward into the more, I guess, cosmetic and aesthetic and comfort pieces of this. People should have an eye exam at our age. How often?
Annually.
And that is for the health of their eyes for a number of reasons, correct?
For a number of reasons. And especially if you have a family history of things like glaucoma, because that's not normal as we age, or macular degeneration. What's normal are cataracts. I mean, we're all going to develop them. To say you have a family history of cataracts, like I have a family history of wrinkles.
Right.
Great. We all are going to get them. But things that can rob our sight, like macular degeneration and glaucoma, you really should be getting checked every year.
Okay. And 2 out of every 3 cases of things like this, blindness, vision problems, are occurring in women. Mm-hmm. So we wanted to put that out there first. Now let's have some fun. Let's talk about how we can wear our lashes, our makeup, and our contacts and things like that, and why we can't. So dry eye, how common?
How common is dry eye? Oh, when you look at the statistics and they say how many people suffer from dry eyes, well, because I specialize in it, I think that number is way higher. I think, especially now we live in a digital age, everybody, even little kids, like my daughter's hounding me to get her a cell phone. She just turned 10. No, you're not getting a cell phone, because all they do is stare at the tablets and cell phones. And then we are on computers, and there's also a link with our blink rate and dry eyes. So we're all staring at these digital devices all day from like sun up until sundown. So we need to put it down and take a break, because something as simple as looking at your cell phone too long or being on the computer too long is drying out our eyes too, because we're not blinking as much. I know it sounds so simple, but
I had no idea. I'm learning so much right now.
It really is. It's such a simple concept. So, we can protect our eye health on the computer with, I'm certain those blue glasses help a little bit, right? The blue light
filters can help, kind of more comfortable vision. But just taking breaks.
More breaks.
There's an old school rule we call the 20-20-20 rule, that every 20 minutes you should look 20 feet away for at least 20 seconds. Just remember to give your eyes a break.
20-20-20. Every 20 minutes,
take 20 feet away for 20 seconds. To remember, just give them a break, because we are all so busy. Before we all know, an hour goes by in the blink of an eye, yep. Right? So just remember to be conscious about blinking and taking breaks. I know blinking's like breathing. We don't think about it. And so I even have written instructions I'll give my patients. I'm sure they're like, oh, she's giving me blinking exercises, but it actually does help.
Are there any other exercises that people could be doing for their eyes other than obviously what you just said, relaxing their eyes, blinking, looking into the distance?
Not necessarily as far as like dry eyes. If people have other issues, then we actually have things like vision therapy we'll put patients through. But on a day-to-day, no. Staying hydrated, blinking, getting rest.
That was my next question, hydration. How is that really a thing, where everybody's at us to drink more water?
Absolutely. It's it's all connected. Our eyes are connected to our body. So if we're dehydrated, the eyes are going to be dehydrated too. So got to make sure you stay fully hydrated.
So is it, they keep telling me put hot compresses on my eyes, like for 15 minutes. Mm-hmm. They usually say to me like 3 times a day, but when you don't have time to do it 3 times a day, do those really work if you have severe dry eye?
Yes. If you have evaporative dry eye, remember those meibomian glands, those oil glands I mentioned? Heat liquefies those oils. Okay. So we try to aim for at least once a day. 10 minutes is the target time. Why? It's to soften and allow those oils to get released into the tear film. It's hard though, because who really have 10 minutes and then 2 or 3, that's 20 to 30 minutes a day. It can be difficult.
Right.
But that's another big thing, is just controlling inflammation in your tear film. So, warm compresses can help, but we got to make sure you're on a full routine of everything that can help. And that's, diet plays a part too. We're talking about hydration and diet. So there's supplements that I'll recommend.
Oh, really?
Which ones?
So there's a certain brand called Hydroize that we sell in our office that I really like. They're larger pills, though. I always tell people that. And there's liquid alternatives by PRN. But that's treating your dry eyes from the inside out, mm-hmm. right? So we can put in our tear film these drops all day long. But if we don't have good nutrients, we need that too, because gut health is related to the eyes too. So it all comes full circle.
Incredible.
Unbelievable.
Some of the things we've talked about in the past on this show with really little regard to, I guess, I don't know. I don't want to say with little regard, but we just didn't realize at the time that it could be a problem until it was suggested to Christine that maybe no, but the whitening eye drops.
Yes.
Because when you have dry eye, your eyes can look red. It can look like you're having an allergic reaction. So, Visine or even one of the
the Lumify, which I was using at least once a day, and I had to cut that out, Yeah.
Well, that's a big one, is redness, and people don't like their eyes when they're red. Usually the big reason for that is underlying inflammation. So those are just a crutch. And when people come in on Visine, I'm like, please cut out the Visine. We can end up getting what's called rebound redness. So some of those get the red out, does it so much that when you try to stop, they just get redder. And it's the most difficult thing to treat because, you want the patient to look and feel good. But when you're using something that's just doing the opposite effect, that's hard. I think Lumify is a little bit better. Lumify was an old glaucoma medication that they rebranded. And so that used to be kind of our trick as doctors will put a little brimonidine in with a tear to whiten the eye. Again, I think it's fine to use as needed. You've got an event or you have something, but on daily use, it's really getting to the root cause of what's going on for you. And then the redness will follow suit. We have to keep in mind, though, as we get older, sometimes those blood vessels in the eye just become more prominent. So I'll have women come in and say, my eyes are red. I'm like, actually, they're not. Behind the microscope, it's just the normal anatomy. I can't get rid of those blood vessels. We don't want to get rid of them. Right. We're not going to sit there and get rid of those. They serve a purpose, right? So sometimes it's as the eye changes, you just notice more of that. But
Uncluttered and Unfiltered is brought to you in part by Hearts for Minds. June is Men's Health Month, and mental health is a vital piece of the well-being puzzle. Guys often face pressure to bottle up their emotions, but that can take a toll. Hearts for Minds wants to change that conversation. 1 in 4 adults, and that includes men, experience a mental health condition. Hearts for Minds helps people impacted by mental illness get the help they need. Visit heartsforminds.org to learn how you can prioritize your mental health or help the men in your life do the same. Take a breath. Take control. Hearts for Minds is here for you. Yeah, what about, you mentioned glaucoma. What about the glaucoma medications that then started being used to grow your lashes?
Yes. So the active ingredient in those is what we call a prostaglandin analog. So when they found that as a side effect in glaucoma medications, they marketed and branded it under Latisse. The problem with prostaglandins is there's a lot of different side effects, which most women don't know, right? And you're not going to necessarily see it in their packaging and their branding, right? They're not going to come out and be like, hey, this has a prostaglandin analog in it. And they'll be different names. So you really have to look in the ingredient list. So you want ones that say prostaglandin free. But prostaglandins are what I always call pro-inflammatory. They make the eyes red. They can make the lid margins red. They can cause pigmentation changes along the lid margin, which thankfully when we stop, that pigmentation can change or go away. But if it gets in the eye, it can actually change the color of the iris, the color part of the eye. That's not reversible. So even when we prescribe that medication for our glaucoma patients, we let people know. If I have someone with hazel, these really pretty brownish green eyes, they're probably going to turn brown if we start this. Full disclosure. But also that inflammation that it brings, also those oil glands we were talking about, they become inflamed and irritated, and we end up getting styes and chalazions, which are painful. Nobody wants to deal with those. And we were talking too earlier, it could also take away the fat in the eye, in the orbit. So you have that, you can get this sunken look. So I always can tell when my prostaglandin patients come in and they're compliant because they have sunken lids, their lashes are really long and their eyes are red.
Oh my gosh.
Wow.
What about the new nose spray they came out with? I was given a sample, but then as they're handing it to me, they said, it tastes terrible.
Is this
You're
going to
hate yes. Oh. You're going to hate the taste of it. And of course, I never even opened it because I couldn't stand having something in my throat that just dripped all day down there. Is that a new invention?
So it is. It's called Tyrvaya, and you actually spray it into the nasal cavity, not all the way up like we do normal nasal sprays, but it's just on the side of the nose because there's a nerve right here that goes back and it causes everything that's responsible for producing good, what we call basal tears. We want oil, water, and mucus. So it activates everything to create these good basal tears. And you actually feel it within seconds. So within minutes, you can actually feel the lubrication. The downfall, because we put it in the nose, that's where most of the side effects are localized, right? Gosh. So you have to, I've tried it. I use it myself.
Oh, you do?
When I wear my contacts, like I don't wear my contacts every day when I'm at work. I usually have my glasses. But when I wear my contacts, same thing. I have to be in dailies. I can't wear them super long because I suffer from dry eyes too.
She's my girl.
That's why you need her as your
yes.
doctor.
But when you put it in, so when I do it, a tip is I squirt each nostril because you have to do it on both sides because it's only innervating that side of the face. and I just kind of hold it for like 10, 15 seconds. I'll pinch my nose, and then you're going to sneeze a bunch, and it's fine. Blow your nose after. It will. The first time I used it, felt like I snorted saline. So you do get kind of that post-nasal drip. It's kind of a little weird. You kind of get used to it, though. Not everybody does, but if they gave you a sample, try it.
I'm going to try it now. I can tell
you, when you got your contacts in, every drop you put in just makes your eyes feel drier. Where Tyrvaya, since it's your natural tears lubricating, the contact's going to be much more comfortable.
You know what? I'm glad you are on this podcast, because I listened to this podcast, and so I just learned something. Maybe somebody else will say the same. I see a doctor, a Florida eye specialist, and I haven't been back since probably this became an opportunity for me to try, because I've been trying to wear contacts. So even though I know you said you probably wouldn't enjoy it because of the taste.
Well, I'm going to try it now. Are you kidding me?
I think I may reach out too and ask if I can try it as well, because that is one thing we did not try. I don't think it was a few years ago was the last attempt we made.
It is newer, so it's new to the market. And there's also, if you're like, hey, I like the way this feels, I can feel it. I don't like the congestion. I don't like the taste. There's an actual handheld device called the iTear 100. So it's no chemicals, no medicine. It's just, it vibrates and you just put it along. Once you find that nerve, so you do it external, you feel the same response. So there's another option.
Wow.
Yep.
That's crazy.
So if you have allergies on top of dry eye, and then you take an allergy medicine, which what does that do? It dries you out. How do you deal with both at the same time if you have like seasonal allergies and you have dry eye?
Well, allergies too, not being treated is going to cause symptoms. So if you have both, you've got to treat both, right?
Okay.
So if I have patients that say are taking oral antihistamines more for eye symptoms than they are, say, for nasal congestion, being able to breathe, those things are important, right? If they're taking it more for the eyes, I try to get off of the orals and just do topical antihistamine drops for the eyes. Now, for some people, again, they can't breathe, they need to sleep. Okay, you're going to have to take the oral medication, and we're going to counterbalance that with what we can use topically in the eyes.
Oh, wow.
Fascinating.
Very, because I've stopped taking my antihistamine because it was making my dry eye even worse. So there's a solution. I like that.
I like watching how passionate Christine's getting, because this is hitting her so where she lives.
Yes.
Let's talk about cosmetics. And we have, boy, do we ever have the right person here to talk cosmetics, dry eye, menopause, all of that. What are you working on?
So I'm excited to announce that I'm working on my own line of cosmetics for patients who suffer, women who suffer from dry eyes. So I'm starting with mascara, and it's been quite the process. I started this almost 3 years ago, trying to find the perfect ingredient mix. You know, you want it to be clean. You don't want any harsh chemicals. You want it to perform, but you also don't want it to overperform, because if your lashes are too long, it actually causes this like wind turbine effect and can actually make them feel more dry. So you want actually a good ratio. You know, it sounds silly, but there's actually a white study paper out there that shows length of eyelashes and the association with symptoms of dry eyes.
Wow.
In this day and age too, where long eyelashes are just all the rage.
Mm-hmm.
Sure. I can see where that would be an issue. They're also out there catching everything, aren't they? Isn't that what eyelashes originally were designed for?
Yep, exactly. Keep debris out of the eye.
So if they're catching more than things that probably wouldn't have even come close in the first place, and they're bringing them in. So forget it. I won't try to be a scientist anymore. I feel like that's your job. So what else with mascara? And there are some other things too. I know you had issues with anything powdered around.
Well, they told me, of course, it was a male doctor, you know, just you're going to have to stop lining the inside of your eye, which I've been doing since like 11th grade, which I was like, what? You know, you have to not use any loose powder eyeshadows. I mean, there's a list of things now that I'm not supposed to do because I have such severe dry eye. So when I heard that you were coming out with your own makeup line, I will be in line as a guinea pig because that's fascinating to me.
Yeah, when it comes to eyeliner, you don't want a tight line. You'll notice this thread, you know, throughout the whole speech and talk, I keep bringing up these meibomian glands, these oil glands, because where did they empty out on the lid margin? So when you put eyeliner over it and those waxes, it's just going to clog them, going to make the dry eyes worse, increase your risk of a sty. I know. So I hate to be the bearer of bad news, but tight lining is a no-go.
What is the best way to wash your eyes at the end of the day if you are wearing makeup?
Good question.
Because I find myself, am I overwashing and causing my eyelashes to fall out because I'm scrubbing so hard or not washing enough of the makeup off? And that's part of my problem.
Yeah. So, well, avoid waterproof. You don't want waterproof mascara, eyeliner, or anything because it's going to take much harsher chemicals and physically rubbing it to get it all off. So that's another with my mascara. I'm making sure you just need water and a microfiber cloth. There's no chemicals, nothing like that. So cleaners like micellar water or coconut oil, things like that you can use. Just I encourage you, if you're going to get like a makeup wipe or remover, look at the ingredients. We don't want any parabens. We don't want a bunch of alcohol. Alcohol is drying. And you'll notice there's some name brands out there that's like number one is some sort of alcohol they're using or, harsher chemicals to remove it. You want more natural ways. So makeup that's not waterproof and easier to remove is key too. So, and like you're talking about with the eye, shadow, it is hard to find cream-based shadows. That's on my list eventually to come out with too, because everything is all loose powders and those particles end up in your tear film and it migrates the makeup. We put it in one area. We're blinking all day. We live in Florida where we're sweating and it's warm. And then that can get into the tear film and cause irritation. So you really want to, if you're going to do just mattes, no like chunky type of glitters and things like that can be more irritating.
What I'm confused about is castor oil because they say you're going to block your glands, with any type, but isn't castor oil and won't that also, if you use it for your eyelashes or any, wiping it on your eyelashes, will oils also block your glands?
So you're cleaning externally, it won't. People will use certain types of oils to help with lash growth and
does
eyelashes.
That work to your experience or have you heard?
With castor oil alone, I can't really speak to it. I haven't done much research on it, but there is 2020 Beauty has
I tried that
serum that is free of parabens. Yep. It was made by an ophthalmologist that has more oils and that are healthy for the lashes.
But that won't block your glands.
It won't block the
glands. Okay, because I have that. I've tried it, but then I got nervous that it was blocked the glands because that's part of what I deal with too is, that's why I'm into the makeup thing right now.
Another question some of our listeners may have is about retinol, Retin-A, things like that, getting close to the eye with those.
Yes. So that's another thing, we want to try to keep wrinkles away, but any kind of anti-wrinkle where it's derived from retinol, Retin-A has a negative effect on those. Guess it again. Meibomian glands. So actually retinol can cause them to not function or we can lose them from overuse of that. So, and it depends on who you ask. Some will say, oh, we'll just keep it away from this area. But we just talked about migration. So we put cream here, but that cream then can move. So I encourage people to find alternative creams that don't have retinol, maybe have other retinol-like ingredients like peptides versus retinol.
Okay. So, it's an interesting high wire act. We all obviously, there are a lot of things we would throw caution to the wind about when we were younger. You can say, listen, I'm only 18. I don't care what they say. I'm going to tight line. I'm going to do this. And then you get to a point where now your eyes are dry and now maybe you're getting the beginnings of a cataract. I'm raising my hand and you are too. Yeah. I was told if I do surgery now, it's too soon.
Yeah. That's what they told me too.
Right. So, I mean, you're starting to experience these things. All of a sudden your eyes become these valuable gems. They should have been all along, but let's be honest, we didn't treat them as such. And now we're starting to realize it matters. And now we have to make that decision. Do we want to wear the false eyelashes? Do we want to use the serum that's going to grow the lashes? Do we want to put the Retin-A all over our face? And I'm not going to lie and say that I'm immediately like, no, I don't want to do that. My eyes are, you go through the vanity part of it.
And also all these commercials, which I've talked to her about before, every time the thyroid eye disease things comes on, because they mention dry eye in it, I keep saying to my husband, I think I have thyroid eye disease. He goes, no, you don't. And I said, but that's what dry eye is. They're telling me. And he's like, no, you don't have thyroid, because you get all these commercials for all these drugs and you immediately think you have all the, these
the
issues.
One that's wet something.
Yeah. WebMD or something.
No, it's one of the eye things they have in commercial. Like if you have wet something with your eyes.
Wet macular
degeneration. Yes. And I think I have that.
Terrifying. It's terrifying. But that's why you go to the doctor and really get diagnosed.
Exactly. If you have symptoms you don't know, because thyroid eye disease can be kind of that masquerader. I've caught plenty of patients that have come to me. They've seen multiple other doctors and they've got all these dry eye complaints. And it's like, okay, well, wait a minute. I think there might be something else going on. And then you can uncover things like that. Another thing, since we're talking about, it's an autoimmune condition.
Yeah.
That's not, everyone thinks it's thyroid. It's not actually directly related to how your thyroid functions. So if you're suspicious, talk to your doctor about it. But other autoimmune conditions start, especially one known to cause dry eyes called Sjogren's. Usually most women are affected. Men can have it too, but we usually get diagnosed between the ages of 40 and 60, same time frame. So I always keep that in the back of my mind when I'm talking with my patients. Do we just have dry eyes? Do you have dry mouth, dry skin, kind of dry everything, joint pain, fatigue?
Don't start getting that right this minute. Christine, do not start getting that.
But that's something else to think about too. So, and then, so we want to uncover that as well, because that can be something that can.
What about Hashimoto's?
Kind of falls in that thyroid.
Right. That's
bucket.
what I have that. So, it all goes back to the regular exams, to talking to your medical professionals, to not trying to self-diagnose.
She's looking at me.
I'm looking at you because I know as you're hearing all those things.
Oh, yeah. Now I for sure have whatever she just said.
I know you want to take a sip of your water right now and go blow your nose.
I'm like, my joints hurt. I have dry mouth. I have dry skin, but I'm also postmenopausal. So,
As you can see, one of the functions of this podcast is that these aren't conversations you're having over lunch with your friends over 50, but they should be. And,
I agree.
Because your husband isn't going to talk about it with you.
Well, every time I get on a plane, I have to take my contacts out before we get on the plane, put my glasses. He's like, what are you doing? I'm like, the air on the airplane dries. It's like a whole thing. My husband knows everything about my eye, the dry eye problem, because it affects every part of my life.
And now people around the world do.
Yeah.
It's like thousands of women around the world know. All of her
Sorry,
stuff.
everyone.
No, but you say the things everybody thinks, and I think that's very valuable. Listen, we would definitely keep you longer. We are planning to do one of our TV segments with you about this very subject, and we have a brand new Patreon system now where people can actually see the video that we just recorded and get more additional behind the scenes information. So all of that's going to be in our show notes, as well as a link to anything you ask us to link to, Doctor. So first of all, let's just say Florida Eye Specialists. That's, I see them without any of this connection right here. That's where I go. If you're not in this area, we're in Northeast Florida, but we have a global audience. Certainly there's somebody near you where you live that can help you with this. But can people find you online anywhere specifically, Dr. Kimberly Riordan?
On our website, on FloridaEyeSpecialist.com.
Okay, good. And then you'll come back when you have some more prototypes in some of your cosmetics line, I'm hoping.
I can't wait.
So
I'm so excited about that.
Yes, I am too.
So excited.
It's they say, you build something people need, and that's the key to success. And so we think you're going to be very successful with that.
Well, I hope so. It's filling a void that I think needs to be filled.
Absolutely. Thank you so much for being a part of our podcast. And for those of you guys that are listening for the first time, because that keyword caught you have dry eyes. This is certainly just one of many, many topics we try to cover. Lots of organizational stuff as well, since Christine is a professional organizer, but we do veer off, as you've just heard, to make sure that we're covering some of the things that we know that you want to talk to other women your age about. So please join us on our Uncluttered and Unfiltered ladies only Facebook group. It's a private group, but we'll let you in. Just ask. And that's where you can ask questions. Also, we have all of the social media. And as I just mentioned, we now have a paid Patreon page where you can access some additional information. And we've got a few projects that are coming your way through that page. So if you want to be an early, I think it's $5 a month. So it's very affordable. But in the meantime, we love you. We appreciate you with all things. And of course, with dry eye, you can let it go.
And hopefully don't look back.